Hello, my name is Avtar. I'm 35 years old and I'm from England. I have been diagnosed with retinitis pigmentosa for about 3 years now. At the time of being diagnosed, I was also told by the specialist that there was no treatment for RP within England. As a result of that, I was quite devastated. The issues that I have with the disease at the moment are field vision difficulties, left and right and down, and also night vision issues as well. I was surfing the internet a couple of months ago for alternative treatments around the world, and I came across Mr. Dr. Osmanfiratli in Istanbul, Turkey, which is when I made contact with him and asked several questions about the treatment that was on offer, what kind of an impact it would have, how it would have an impact, what the treatment actually involved, what the results would be, whether they would be long-lasting, short-term, etc., etc. It was a very long procedure in terms of firing questions, getting answers back, firing questions, answers, getting answers back. And then eventually a decision was made by myself that I will go to Istanbul and I will see what the treatment is all about. I have had alternative acupuncture treatments in the past, but the results have not been long-lasting. That's what made me really decide, having studied the internet, having studied some of the case studies from Dr. Osmanfiratli and the impact that some of the field vision tests resulted in were quite impressive. When I arrived here in Istanbul in November, I was very anxious, very nervous about what was going to happen, how things were going to progress, if they were going to progress at all. However, when I got here, things did start to feel a little bit more comfortable. The people in Istanbul, upon my arrival, were very friendly, very helpful, and you can ask them anything that you want as well. On the first day, we went to the hospital, myself and Gurkhan, which is where we had to conduct a field visual test, which measures your acuity, which measures your field vision around the eye. Once that was complete, I came into the clinic, and it was quite surprising to see how many people there were in the clinic with retinitis pigmentosa, and that brought a warm feeling, as I was one amongst many people with this disease. I embarked upon my first treatment, and having had the first session, I saw some quite good results. My acuity had improved slightly when I was looking out of the window. I could see a little bit brighter. The colours were a lot more sharper. On the evening of that first session, I went back to my apartment. I could see that the entire apartment was a lot brighter. The leaves on the trees outside were a lot more deeper in terms of a deep green colour, and I thought, well, something is definitely changing. During the course of the 20 sessions, which was what I was advised to take upon, each treatment led to improvement, slowly but surely. Whilst I've been at the clinic, I have spoken to a lot of people who have come here from not just Istanbul but worldwide. At the end of the day, I've met people from Germany, from Syria, also from England, from Egypt, as I said, from all over, and we are all in the same boat at the end of the day, and everybody is having improvement. I have come to the end of my, or almost at the end of my 20 sessions now. I have had a remarkable experience within Istanbul. It is a very cosmopolitan city at the end of the day. You will not get stuck for anything. Compared to England, there are a lot of shopping malls, a lot of shopping centres. We are very close to the beach here. Obviously in the summer it will be a lot better, I hope. As I said, almost at the end of my 20 sessions, I have had my second test and I have had remarkable results. Now the difference that I can see my field vision has improved. I'm not bumping into the curb, I'm not bumping into people whilst I'm walking around in the streets. I am able to see the curb on the floor, on the road, on the footpath. My night vision has improved dramatically. I can now focus through the central of my eye whilst walking at night, whereas previously I used to have to look through the side of my eye in low light or dim light. I look at my mobile phone, I can read it from quite some distance rather than bringing it close to me. I am able to walk a lot more comfortably during the day, as I said earlier on, not bumping into things or items or people for that matter. So overall, I am very happy. The treatment here in Istanbul with Mr. and Mrs. FIRATLI has worked. I am eternally grateful for their assistance, as it will have an impact on myself, my life, my family and my work.
Hi, I'm Visionfieldtest. I'm also a last year medical student and here working with Dr. Osmanfiratli. I'm right now here to explain you the details of the Visionfieldtest of Mr. Avtar. He had only 18 sessions and afterwards we got a Visionfieldtest for him. The amount of time he was here is right now about 1 month, and I will try to explain you what differences in the Visionfieldtest he has and what differences have which meanings. Okay, right now that one is the first Visionfieldtest of him on 14th November 2011, and here in the middle you can see green fields, and on the middle of that field is the yellow area. The meaning of that area is that's of course his central vision, and you can see clear from that, you can see sharp from that area, and you can also see the distance, far distance from that area. So about here there are red areas, light red and dark red. These are also acceptable areas which the eye can see. The images maybe not so clear like green or yellow, but from that part of his eye he could only also see and read. The purple area is the areas where he can see. Yes, he can see, but he can't tell detailed information what he sees, because if that part of his eyes would have been green or yellow or maybe light red, then he could also determine what he was seeing is from that part of his eye. And with black areas, these are the areas where he couldn't give any reaction when he sees something, because he can't see. When he tries to see from that part of a room, for example, from that part of his eye, he can't say that something is here. He can't even say that yes, something is here. So we applied him 18 sessions electroacupuncture treatment in FIRATLI clinic here, and after that we repeated the Visionfieldtest, and on 16th December he had his, exactly after 1 month, he had his second Visionfieldtest, and here we compare his right eye. Please see the green fields right now, how they changed, and also the peripheral vision, how they changed, how the black areas decreased. Right now you see the green area, it has enlarged really very much, and which determine that's the reason that this green eye area is that much, is the biggest reason. He can right now he can read his phone from a further point, and he can also see the far distance much better. He can read much more easily, and the peripheral areas has also been expanded. If you see these red areas where it has been before, it was black, and these black areas has also turned to red and dark red, and on some places on purple, which means that his peripheral vision has improved, and that's why when he walks on the road, he doesn't have the tubular vision anymore, and he can see what's going on his left part or right part, and he can react before something happens, and he doesn't bump onto something. Coming to his left eye, that was before the treatment on 14th November. He doesn't have any much more problem in his central vision. It was also very good when he found us, and but he had on that part of his eye, the black areas, his peripheral vision is really very deteriorated, and this shows us that right now his disease is improving very fastly. Also, the patient has told us that in the last years it's going to worsen, and as we know that retinitis pigmentosa is a progressive disease. In time, this area here, this area on the peripheral area will deteriorate, and then it's going to deteriorate on these areas, and at last these green areas in the middle will turn to red, and then to brown, and then black, and the patient will only see, maybe a little bit feel the light in the end of the disease if he doesn't get any treatment. After our treatment, in 1 month, after 18 sessions, so we had really big improvements here also. As you see, the green areas has enlarged too much, and here we have like a white area, which is the most important thing, and on the also on the peripheral vision we have yellow, red and purple areas. That's also, as I mentioned before, why he can see better right now, why he doesn't crash on something when he walks, and he can also see much more right now, much more sharper, the colors and everything. That's the reason of it. When we have to compare his situation before and now in numbers right now here, before the session he had a sensitivity of 9.6, and after that it's like 12.1. So there is an improvement, like minimum of 40%, which has the meaning that this patient maybe in that time he had that type of worsening in his vision, but in only 1 month we applied him 18 sessions electroacupuncture treatment, and we stopped his disease from getting worsening, and his vision has been improved like 35 or 40%, and which is also on the left eye the same. It's from 8.2 to 10.8 or like that. So which also gives us the confidence that this patient, not right now, his problem has been stopped, and we managed to improve his vision, and it's going on like that. When this 20 session shows us that most probably after another 20 sessions we will have cured this patient completely, and he will never have this problem again. So